An estimate say 7,300,000 people die by suicide worldwide each year. The global suicide rate is over twice as high among than women. Over half of all deaths by suicide occur before the age of 50 years old. You will be shocked to know that globally suicide is the fourth leading cause of death. Suicide cannot be a solution to any problem. Why one chooses to end her life is frightening and depressing with no easy answer. The world is an unfair place, and suicide is considered as a desperate attempt to escape the suffering that has become unbearable. Motives for suicide are usually things like pain, misery, and despair. It's tough because the pain is real and sometimes suffocating. Most suicides are due to temporary depression or despair. Blinded by feeling of self-loathing, hopelessness, and isolation, a suicidal person can't see any way of finding relief except through that. They wish there was an alternative to suicide, but they just can't see one. And in the process, they forget about the misery that their death brings to their people. It is not simple to get rid of thought suicide, but there is a way to keep facing life. But one needs to be willing to try at least. Suicide is related to brain function that affect decision making and behavior control, making it difficult for people to find positive solution. 19% of people who die by suicide have an underlying and potentially treatable mental health condition. Depression, bipolar disorder, and substance use are strongly linked to suicidal thinking and behavior. Specific treatment used by mental health professionals such as cognitive behavior therapy (SP) and dialectic behavior therapy have been proven to help people manage their suicidal ideation and behavior. No one takes their life for a single reason. Life stages combined with known risk factors such as childhood trauma, substance use, or even chronic physical pain can contribute to someone taking their life. Most will be relieved when someone starts a conversation. Most people who survive a suicide attempt, 85 to 90%, go on to engage in life. There are 5 ways to free yourself from worry of suicide. If you follow the following step, maybe you can recover yourself. First, remove yourself from danger. Thought of suicide can hit a hardest when you are in a potential dangerous area or situation like driving, station on a balcony, or near guns, open, or other potential harmful object. If this is the case, physically remove yourself from the area or situation in order to minimize the potential of acting on suicidal thought. Second, slow your breathing. Suicidal thought can be scary and it's easy to get overcome. Slowing your breathing helps reduce your heart rate, while also shifting your attention away from whatever thought you are having. Take a few deep inhales and exhales to regain control of your breath. 4 seconds in, hold for 4, 4 seconds out, hold for 4. Repeat. If your second is too long, start shorter and try to walk your way up. Third, refocus your attention. There are many ways to do this, and some will work better for you than others. The goal is to work towards shifting your attention away from the negative thought of hurting yourself into something else. It can be tough at first, but the more you practice, the more you will be able to distance yourself from this unwanted thought. There are 3 practical steps you can follow. Visualization. Focusing on breathing can help, especially when combined with visualization. Imagine your lungs filling up with air. The more detail you add, the more better it will be. If you are counting your breath, you can also try to visualization writing out the number like 1, 2, 3, 4. For some, imagine yourself in a safe and climbing space. Being with someone you love or looking to your faith can help. Relaxation. Often when you feel overwhelmed, your muscle tighten without realizing it, like a shoulder or jaw may flex, or you may clench your hand into fist. On relaxing your muscle, start with your hand and shoulder. Try to relax each muscle group working you may down, like face, jaw, neck, shoulder, back, arm, legs, clubs, etc. You can use your hand to massage your neck or shoulder as well. Reaching out. In addition to the step above, reaching out is crucial. Even if you don't think the thoughts are that serious, talking about them with others is an important step to addressing and taking away the intensity of this thought. Yourself with people you care about, rather than shouting down and isolation yourself. For people to help you, have to let them know what's going on. Worries or fear of being locked up prevent you from reaching out and sharing your suicidal thought with others. A variety of mental health professionals and levels of care that can help, including finding and talking to therapists. Remind yourself of recovery. Part of recovering from depression is learning to overcome this type of thought and feeling without getting further bogged down on yourself for having them. Yourself that recovery is possible. Many men have had similar thought and feeling about suicide and survived. Even men who have had to take their lives multiple times had been able to recover. Suicidal thoughts can be alarming, but they do go away. Try to figure out the best step for you so you can weather any storm. Is never an option. Life if not for anything but to prove your doubters and sometimes yourself wrong.